Ready. And we're live. What's going on? Hey, real quick, let's fill the comments with where you're tuning in from. It's cool to see all you international folks returning and registering. I know you're probably sleeping right now, but you'll definitely be able to catch the recording. But yeah, invite your friends. We're going to have an awesome time tonight. I promise that you all will learn at least something new. I'll be covering a lot of good information regarding muscle and back pain. And to start things off, I want to remind you that science, it's always changing and improving, as it should, especially when considering the human body. Now, I do want you to know that the science that I'll be sharing tonight is current, up to date, because here's the thing, as a health professional, I have to keep studying and seeking out the best up-to-date information to ultimately stay ahead of the curve and to keep you all updated. Because the moment that we stop searching for better and faster solutions for back pain and other conditions, that's the moment where we let you down, and that can never happen. Now, fortunately, you've got people like myself, a lot of other great healthcare professionals that really care about advancing the health industry, because we know that you're relying on us, and we don't take that lightly. By the way, who wants to win a $50 gift card to their favorite local restaurant? Super easy to challenge. All you have to do is take the best notes and what you took away from this webinar, nothing longer than one page. And whoever takes the best notes, I will personally buy them a $50 gift card. Now, here's why I do this. First, it captures attention. And second, it really helps me review what I think I said and what you actually heard. I want to make sure that my message creates the right impact. So let me know in the comments if you're interested in accepting this challenge. But other than that, let's get started. My name's Dr. Burt. I'm an upper cervical chiropractor. Super excited to be here with you during the next 40 minutes. We're going to fly through this information, a lot of it to get through. So roll up your sleeves, handwrite some notes. And of course, tonight's topic is unraveling back pain. This is by far my most requested workshop of all time. And I've done this live several times down in California, at least. And based on my track record, I know you'll all get a lot out of it and ultimately have a kind of leave tonight with just a different perspective on back pain. Now, over the years, I've found that people always ask me these two questions. First, of course, what causes back pain, right? What is the underlying problem that exists here? And so what I'll do, I'll go through two specific causes of back pain. One you've all probably heard of, it's very well known, but the other I can almost guarantee you haven't heard of. And although it is still common, it is by far the most overlooked cause of back pain. And what I'll do is I'll walk you through that neurological cascade of how this specific cause will cause back pain. And I promise I'll keep the science nice and easy, simple to understand. So I'll do that for you. Now, second, of course, how to correct it. How can one get lasting pain relief while correcting the underlying problem at the same time? So I'll shed some light on some good solid solutions. But yeah, I'll also be answering some questions at the end. So if something doesn't quite make sense or you'd like me to dive deeper into a specific concept, please remember that thought and post it up at the end. Sound good? Alrighty. Now, before we start, I'll introduce myself. As I mentioned, I'm an upper cervical NUCCA chiropractor. NUCCA stands for National Upper Cervical Chiropractic Association. There's only about 250 NUCCA chiropractors in the world, and I learned how to do NUCCA down in the California Bay Area, traveling all over the country, several conferences and seminars. But now I'm grateful to be back in my home state in Oregon, helping hundreds of people overcome back pain by ultimately tracing it all the way back up to the neck. And so yeah, enough about me. Let's get started. So I'll start with a few interesting facts on why back pain is just such a pandemic. Number one here, we got back pain is the number one leading cause of disability worldwide. So when you're disabled, of course, you're not working. And when you're not working, you're not making money, unless, of course, you have some sort of third-party policy. But yeah, it's not good. As far as number two, we've got 50% of working Americans admit to having back pain symptoms each year. So all you, yeah, it's important to consider. Well, here this next one. This one, it's even better. But yeah, as far as 54% of Americans suffering with back pain spend the majority of their day sitting. So all of you desk and computer workers, make sure that you have access to a standing desk. And if not, try to get them ordered. Be sure to get them ordered. Speak with your doctors, get the medically necessary signature, get those claims submitted. Most of your companies will pay for it. All you got to do is just ask them. But yeah, I mean, regardless, it's a small investment and your back will thank you later. Given the situation right now, I know a lot of you are working at home. And, as far as if you have to do some sort of MacGyver standing desk setup, using a bunch of books, boxes, just whatever you have to do so you're not sitting for longer than 30, 45 minutes at a time. 45 is a little bit long, so let's cut it down to 30. Anyways, so we've got 4. We've got back pain is the 3rd most common reason for visits to the doctor. Now we have ahead of that, we have skin disorders and osteoarthritis and joint disorders. Now, by the way, make sure you stick around, hang out until the end. I'm going to be really explaining spinal osteoarthritis in the most simplistic way that you'll ever hear. Anyways, number 5, we've got this one's insane. If you add up the cost of back pain treatment with the cost of lost wages and decreased work productivity, then that is going to add up to the total number is going to top out at $253 billion every year. Incredible. 6 and final. Still, of course, the number 1 treatment for back pain is still medication. So you got your painkillers, your over-the-counter meds, as far as like aspirin, ibuprofen, other anti-inflammatories. But now, think about this. What's the explanation behind all this? Why is back pain such a just debilitating, a good majority of the world? Is it something that people are doing too much of? Is it something that people aren't doing enough of? Is it something they're not doing at all? And so it's really interesting. And being in the back pain industry for years now, it's been interesting to see all the variables that do influence it. Whether it's from diet and nutrition, you've got movement and exercise, to trauma and injury, and even the mindset. I mean, there's just so many things. And with that said, I'm not a nutritionist or a dietitian, not a personal trainer, physical therapist, of course, not a psychologist. So I'm, of course, going to defer those topics to those health professionals. So, if you came looking for nutrition advice or some movement advice tonight, then unfortunately you won't get that. But I will say this about nutrition. It ultimately breaks down to 2 things: deficiency and toxicity. Now, this is the most simplistic way to think about it. You got nutrient deficiency, nutrient toxicity. You need to know which nutrients you're not getting enough of and which ones you're getting too much of. Of course, a good solid nutritionist will help you in this aspect with all, of course, measuring those. But yeah, that's all I'm going to say about that. I'm going to stay in my field of expertise by focusing on how trauma and injury causes back pain. Specifically, more so like the micro trauma and the macro trauma to the spine. But yeah, it's great. You're going to learn a lot of good things. So we've got the most common cause of back pain. Ready? Is repetitive injury. Now, how many of you have heard that? Probably a lot of you. Now, who wants to hear a bold statement? We got, according to this medical doctor, his name's Dr. Vladimir Yanda. He said that most people spend 23 out of the 24 hours in the seated position. Now, let me explain that. So let's say the first thing you do in the morning, you get up, you get ready for work, and you head downstairs, and let's say you sit down and eat breakfast. Then you get up, go to your car, sit down, drive to work, and then you get out of your car, walk to your office, sit down in your chair, and start typing away on your computer. Let's say you're working for 4 hours, and then at noon, you get up, walk over to the break room, sit down and eat lunch, sitting there for we'll say, 30 minutes or so, probably leaning over on your phone, checking social media. But after that, you get up, go back to work, put it another, we'll say, 4 or 5 hours. So 5 o'clock comes around, you are, by now you're probably feeling a little bit stiff. And so what you do is you head to the gym, get in a good solid workout. We'll say you get there, but no, you're not lifting weights. You decide to sit down on the bike for 45 minutes. And so after that, you drive home, sit down, have dinner with the family, walk over. After that, you walk over, plop down on the couch, watch some Tiger King, some Netflix. Anyways, but here's the thing. Now you're probably getting a little bit tired, so you go to bed. And here's the thing. So 70% of people, they are going to be sleeping on their side, curled up. And, if you think about it, the sleeping posture doesn't really look too much different than the seated posture. And when you're in this posture, some really interesting things in the body will start to happen. Let's go back to here. Now, here's the thing, right? Anytime that you have static, prolonged posture, your risk of developing muscle imbalances is much higher. And in this case, your hip flexors are shortened while your butt muscles are lengthened. Now, this is why you see a lot of people walking around with what we call anterior pelvic tilt. The hip flexors are so tight that they are pulling the top of the hip forward or anterior. Now, at this point, it's only a matter of time before the pain sets in and you have to go see someone for help. And this is when you get the diagnosis, lower cross syndrome. Now, in essence, this is tight hip flexors and hamstrings with a weak core, abs, and glutes. And you can kind of see the infographic here. But we've got the simple cascade here, starting with repetitive injury, of course, of the seated position. And, prolonged sitting will lead to low back and hip muscle imbalances, which we call lower cross. And then, as I said, it's only a matter of time before the muscle imbalances get severe enough to actually cause pain. So, although you may not be, sitting for, all the 23 hours that was described, but based on the data, you are likely spending a lot of time in the seated posture. And remember what I said earlier, 54% of people that have back pain have a job that requires sitting. So make any excuse you can to get up, move around every 30, 45 minutes or so. Now, although repetitive injury is a legitimate cause of back pain, there's no doubt about it, but I've been in the industry long enough to know that it gets diagnosed way too often as the only known cause. And even for me, this was my experience as a college athlete. And I know a lot of you will be able to relate. So as far as, when I was in college, I suffered from tons of muscle imbalances that led to some intense back pain. It affected my studying, my workouts, and it held me back when I competed. I threw the shot put in the discus in college, loved those days. But yeah, when I worked out, my left lower back would always tighten up way more than the right, and then when I ran, my low back would just burn. And then of course, sitting in class, I would literally have to sit in the back just so I could, stand up and move around without being a distraction. But, being as stubborn as I was for the first year, at least, I just pushed through the pain thinking it would just get better. Or something. But then when I realized, that my back problem was just getting worse, then I asked for help. And so for me, I started with the athletic trainer, doing exercises, foam rolling, ice baths, you name it. I did it. So that didn't work. But then I went and saw the top physical therapist in town, did a ton of corrective exercises, corrective stretches, some muscle work, where they take those tools and just go for the muscle. Graston, that's what it's called, man. That stuff's brutal. Hey, it works, it's great, but man, if you've ever tried it, you'll know what I mean. But then after that, what I did is still struggling. So I saw a chiropractor, definitely help out more as far as what else I did, as far as and here's the thing, like the popping, it definitely gave me more range of motion. and helped. But other than that, I mean, nothing really worked. I mean, everything was relatively temporary and lasted a few days, and then the imbalances and pain would just come back. But here's the thing: the funny thing was, everyone that I worked with, they all told me the same thing. That my pain was because I was overusing the muscles. Repetitive injury, sitting in class all day, studying. It was my workout form, right? Like they drilled this repetitive injury concept into my brain. And you want to know the universal solution that they recommended? Ready? Well, stop doing that then. Stop lifting heavy, change your form, stand up in class more often, do these exercises. If only your core was stronger, do these stretches. Are you icing 5 times a day? And literally, like, this was how my paradigm of how I thought back pain and imbalances were treated. And like most of these things I was already doing. It just seemed like, they were missing a piece of the puzzle. That's all. And I was right. And I personally didn't figure this out until my second year in chiropractic school. And of course, I chose to go to chiropractic school in the first place because of my own experience. I thought this was the best route to help people struggling with back pain, muscle imbalances, and just other conditions, and improving athletic performance. So that's where I started, at least. But yeah, like my first year, I took 11 different elective seminars: sports chiropractic, extremities, applied kinesiology, muscle work, body work, advanced structural biomechanics. Like, you name it, I took it. But then, the start of my second year was when everything really changed there. So what I did, I attended a upper cervical chiropractic seminar, and this doctor was the first one ever to tell me that my back pain was stemming from my neck, and that until I fixed my neck, I would continue to struggle with the imbalances and back pain. But I was confused because all the previous professionals that ingrained in my head that my imbalances were coming from repetitive injury. And of course, I'm sure that just exacerbated things and added on to it, but no one had ever told me that they were coming from my neck. But anyways, I gave this upper cervical thing a shot. I mean, I had nothing to lose. Now, I'm not going to get into all the details of how we did the assessment, did the correction of my neck. And to be honest, I didn't care. I just wanted a better solution. So he did the correction before it was like the weekend seminar. So before it was over, he did it. There was no twisting, popping, or cracking. I was lying on my side, and it was like gentle pressure right behind my ear. But that next Friday, I was shocked. I did my leg workout, did some squats, some sprints. And for the first time in years, I vividly remember it. Like, I didn't have back pain or knee pain when I was doing those movements. But the idea just bogged my mind. Like, how could, after one neck correction, I could notice such an improvement in my body? I mean, I just didn't understand it, which intrigued me even more. I mean, I had my neck cracked several times before, but I'd never felt like this. And so what I did is I reached back out to the upper cervical doc, told him my experience, and asked if this sort of thing was common. And what he shared, I'll never forget. He said, "Corey, if you take this rubber band and you wrap it tightly around your wrist, what do you think will happen to the fingers over time? They could start to turn white. They could lose sensation. You may feel a little bit of pain. Eventually you would address the problem, which you did. Now, what you could do, you could start by rubbing the fingers, stimulate some blood flow, similar to massage. You could move them around a bit, similar to exercise. You could take a pill and cover up the pain. You could ignore the fingers completely and just let them die off and replace them as they go down. Or you could start by simply just removing the rubber band. Remove the rubber band and then wait to see what happens to the fingers. And that's exactly what we did. But instead of thinking about the wrist, it was your upper neck. And I'll tell you, I'll never forget that. It just made so much sense. Like, the light bulb went off in my head and my brain just clicked like that. And like, the more I thought about it, the more it made sense, because all the neck and head injuries that I had from 10 years of football and wrestling, concussions, it really did make sense. But after that, like, I just felt that I had to learn the why behind it all. Like, it didn't really catch my attention until I saw that it worked. Now I wanted to know why it worked, and like, how can something up here in my neck affect my back and the rest of my body? What's the reasoning behind this? What's the neurology, and really, like, what's the science behind it? And that's what I spent the next 5 years doing, and just doing a deep dive into that. And it's ultimately what I want to share with you right now. It's the most overlooked cause of back pain. It's the underlying cause. Let's get back to the presentation here. But yeah, it's the underlying root cause behind back pain, and why it's so many people. I've seen it time and time again, and I'm so surprised of how few people actually know about this. Anyway, so it's going to be great. You're definitely going to want to remember some of this stuff. I will be going fast. Like I said, we got to get through it, but at the same time, I can promise you'll learn something new. So we've got the overlooked cause here is head and neck injury. Now, it could be from sports growing up: football, soccer, wrestling, basketball. It could be a gymnast falling on their head, a fighter taking a blow to the head, any form of concussion, falling off a bike, hitting your head on a cabinet, any sort of whiplash injury from a car crash. This is big. But yeah, I mean, like anything that jolts the head and the neck is potentially going to, create damage. And what I want to walk you through is this damage, right? It's the neurological cascade of how a head and neck injury will affect the entire spine, which does cause back pain. And what I'll do is I'll break down each and every one of these steps. And as I said, I promise to keep it simple, easy to understand. Anyways, so the first thing that needs to happen is we've got a head and neck injury, right? And this is going to do a couple things immediately. One, it's going to tear loose and stretch the connective tissue that basically holds the head over the center of the neck. So it's mainly the upper cervical ligaments that are going to be damaged here. And now all of you should be able to see this animation. We call this an upper cervical misalignment because the top bone in the neck has shifted out of its position, and which is going to cause the head to tilt and the lower neck to angle underneath it. And when this happens, the suboccipital muscles are going to stretch because, of course, they're attached to the base of your skull and the top two bones in your neck right here. So you can see a good depiction of these images here. These are the suboccipital muscles. And so here's the thing. How do we know that these are, so real quick, these, the suboccipital muscles are the most sensitive muscles in your entire body. And how do we know this? I had an extra slide in here. How do we know this? Is because of muscle spindle density. Now, like I said, I'm going to keep this simple, but every single muscle in your body has a certain number of muscle spindle fibers that's going to send information to the brain. And so the suboccipitals have the highest number of muscle spindles compared to any other muscle group in your body. And as you can see here, there's going to be 4 on the left and 4 on the right. First one being obliques capitis inferior with 242 muscle spindles per gram of muscle tissue. This is the most sensitive muscle in your entire body, right here. Obliques capitis inferior is the most sensitive. Then, of course, coming in second, we have obliques capitis superior, and that is going to have 190 spindles per gram. And of course, third and fourth, we've got rectus capitis posterior major, and then rectus capitis posterior minor coming at 98 spindles per gram. And then just here's the funny thing, to do a little comparison, the biceps brachii has 97 total muscle spindles. So this isn't per gram, this is total. And the bicep is much larger and weighs a lot more than all the suboccipitals combined. So, it's pretty substantial when these muscles stretch. Now moving on, when these muscles do stretch, what's going to happen is the mechanoreceptors are going to activate. Simply explaining this, like think of mechanoreceptors being the ones who sense that the muscle is stretched and now have to communicate that to the brain. And they're very sensitive with any sort of abnormal motion occurs. And it's important to know that there's 82% of all mechanoreceptors in your body are going to be located in the upper cervical structures, muscles and the ligaments. Anyways, so once that signal releases, it's going to send up lamina 7 of the spinal cord. And not to get into too much detail, but just know that the spinal cord is a total of 10 different sections, 10 major pathways in which information is sent to and from the brain. And so the signal is going to continue up to the cerebellum. We've got the posterior lobe of your brain that's mainly responsible for coordinating and controlling like equilibrium and balance. And so the signal is going to continue to the vestibular nucleus, which is going to be located in the medulla of the brainstem, which is right in front of the cerebellum, highly responsible for any sort of eye movement, controlling the eye muscles. And it also works hand in hand with the cerebellum to keep you upright and posturally balanced. So now that the signal has reached the vestibular nucleus, what it'll do is it's going to tell the spinal postural muscles on one side of the spine to contract and tighten. Now hopefully everyone can see this animation. And the posture muscles that I'm referring to are your erectors. Your rotators, your multifidi, and your QL, quadratus lumborum. Now keep in mind, these are the extensor spinal postural muscles. And okay, so here's the thing. Now I'm not going to go down the scoliosis rabbit hole, but hear me out real quick. The super interesting study where researchers took a bunch of rats, purposely damaged their vestibular nucleus. And then what they did is they hooked them up to an EMG machine to specifically monitor the muscle tone. And at the end of the study, they imaged the rats, took some x-rays, and they found that 25% of them developed a significant spinal scoliosis. And get this, on the side of the convex, so the convex side of the scoliosis, all of the rats had hypertonic spastic musculature just pulling it over. And they knew that because they had them hooked up to the EMG. Now, that's all I'm going to say about that. And I get it, they're just rats. But it's still another interesting data point to really see how something at the level of the neck influences and affects the rest of the spine. So back on to human muscle imbalances. Now, once the posture muscles contract unilaterally along the spine, what the body will do is compensate. And so it'll compensate by leaning to one side or the other. Notice the green line in this photo, or the vertical green line in this photo. This line is at the center of her feet, goes all the way up, and normally the line will pass through the center of her nose. But with her, you can see that her spine is shifted off center, leaning to the left. And now I can only imagine how much more pressure is being placed on the low back discs, right? Because that's what's going to take the brunt of the pressure. And ultimately, like the longer that the posture is shifted away from center, the more pressure and compression will be placed on the spinal discs. And it's only a matter of time before the discs become less stable and begin to bulge, especially at the lower back, because they've got the weight of the entire torso and the upper body compressing down onto them. And this is why you see L4, L5, S1 come up so often in reports. And okay, anyways, so quick thing on disc bulges. Think of a disc as being like a heavy duty water balloon. So you start with 15 empty balloons and then you put them inside of one another. So it looks like one really thick balloon. And so you fill up the balloon with water, and the only way for the balloon to pop is if all 15 layers are ruptured. And so a disc is going to be the same way. We have the center of the disc called the nucleus, made up of mostly water, and it's surrounded with about 15 annular fibers that protect the nucleus. And so even as you can see here, we've got the nucleus, the light pink, and then the annular fibers are going to be surrounding the nucleus. But yeah, like as the annular fibers are stretched, from some sort of injury, like this is when you'll likely notice the pain or symptoms. And keep in mind, like all pain really is a protective mechanism by your body. It's the reason, the reason why you have pain is just because like the brain recognizes that the back joints are unstable. And so the pain is designed to stop you from moving. Why? It's to protect the spinal cord, making sure it doesn't get damaged. But regardless, if you have symptoms or not, the brain knows exactly what's going on. So in this case, like we'll start with like a small disc bulge may just cause, some local back pain. But if the disc is severely bulging into like the sciatic nerve, you can see here, bulging, really stretching out, pushing into that nerve. Now, this is when you're going to see the pain, tingling, and numbness shooting right down through the leg and even into the foot. And this is, what we call sciatica. I was speaking with a patient a few weeks ago that came in with sciatica here's the thing, she came in saying she bent over tire shoes, and that's what caused her sciatica. And although this was the tipping point, the problem wasn't that she bent over to tire shoes. The real problem was that she had lost her spinal integrity over the years, and her spine was just getting weaker and weaker until the slightest movement, it just simply like bending over, was just the final straw. And boom, that's when you'll notice it. Now, when the disc is initially injured, the first thing the brain will do to heal it is coordinate the delivery of protein, water, and red blood cells to the injured area. Now, I know a lot of you have heard of inflammation be thrown out. It's very commonly spoken about, but really just know it's just red blood cells, water, and of course protein. And so now the area is getting inflamed, which makes it feel like your back's going to feel stiffer, which could make it hurt more, and it could make you want more adjustments, more stretching. It could make you want cortisone injections, some pills, anti-inflammatories, pretty much anything to try and remove the inflammation. Now, if there's one concept that you leave tonight with, please understand what I'm about to tell you. Now, if you don't fix what's wrong structurally, then at a certain point in time, your brain says, okay, this inflammation is not strong enough, not enough stability. We've got to do something extreme here because we are losing the health of the disc. So the last thing that the brain will do is purposely coordinate the stealing of calcium from unimportant bones in your body, and the calcium will be dragged through the spine and dumped around the injured disc. Now, the goal here is to try and concrete the weak area being the spine, and to give it maximum stability. Now, after this happens, it's very common to see two separate diagnoses. The first will be osteopenia, osteoporosis in the bone that the brain stole the calcium from. Now, most commonly, you'll see this in the arm bones, the radius or the ulna. Why that happens, like I said, it's what the body deems least important. Now, the second diagnosis will be osteoarthritis and bone spurs. And you'll see those at the level of the spine where the injured disc was. Now, I need you to understand all that really happened was that the calcium simply moved from the arm to the spine. One area of less importance to an area of more importance. Does that explanation make sense? Let me know in the comments if you have any questions about that. I tried to keep it as simple as possible. I do want to say one more thing about this though. If you do have bone spurs, please do not let other health professionals tell you that you got the bone spurs simply from just because you're getting older. Just completely false. I know several older folks that don't have any bone spurs in their spine, no osteoarthritis, nothing, healthy. And to say that simply getting older is what causes the arthritis is completely false. I mean, here's the thing, if it was truly age that was causing the bone spurs, then wouldn't you notice bone spurs throughout the entire spine? Like, think about that. Why just a few? No, are some discs really older than other discs? No, it just doesn't make any sense. So the problem isn't that the disc is getting old. The problem is that the disc is losing its integrity and basically has become extremely weak from all the additional compression that the spine is being from the spine being shifted off center. Now, with all this, here's the overarching concept. Let me switch screens here real quick. But here's the thing, like it's an above down cascade, not ground up. The only time you can debate this concept is if you blow out an ankle, blow out a knee, break your leg or something. But the neurological case will always support above down, starting with the brain and what's closest to it. And I'll tell you, like I believed in the whole ground up approach. Your bad shoes are going to give you knee problems, which are going to give you hip problems, which are going to give you back problems. No, throughout the years of studying this, I asked multiple chiropractors this question. And, is it above down? Is it ground up? Like, what is it? And here's what I learned. Now, most chiropractors will take pre-X-rays and then post-X-rays down the road to prove that they actually made a positive change in the structure of the spine. Now, the only ones that were getting the changes to occur in the low back and hip were the upper cervical chiropractors. Literally, my mentor docs would show me this. They would take an X-ray of the low back before care and then would only work on the neck. 6 months later, they would take another X-ray of the low back, and not only was the lumbar spine straighter, but the hips were balanced. Now, when I saw this for the first time, I also asked the traditional chiropractors like that were, hammering away on the low back and hip, popping away, same adjustment over and over again. And you know what they said? They said that they stopped doing the post X-rays of the low back because they didn't see any changes. So imagine hearing that going through school. Now, I'm not here to, bash other chiropractors. Like I said, it got me to chiropractic school. I love it. It's going to help a lot of people. But it is interesting hearing this idea and philosophy going through school. And so, I've got to, share it. And here's the thing, like it's nice to have the neurology explaining why it works, but it's even better to have the data and the images. I mean, especially me, like that's how my mind works. Math, data, that's how it clicks. Pre-post, it's just, I think it's better. Anyways, that's my opinion. You can take it for what it's worth. But like, by the way, like if you want to see any of this other research of anything that I discussed, I'm more than happy to share the citations. Anyways, so would it be okay if I shared a few solutions with you? Nod your head. Again, I'll keep it very simple. So let's get back here. So if your back pain is unrelated to your neck and you do not have any underlying neck problem, then here are the solutions, right? So starting out with massage, whether that's a Theragun, you're doing it yourself, or you actually hire, a licensed massage therapist, or even more specialized muscle work like the Graston I was talking about, or active release technique. That's all great. And for some of you, if you can handle the Rolfing, that's been shown to be really substantial. Of course, your traditional chiropractic being the joint manipulation. And of course, the most popular is going to be physical therapy, those corrective exercises. And as I said, whether that's doing it yourself or seeking out an actual physical therapist or some sort of movement, functional movement specialist, like a personal trainer, strength coach, right? They all recognize that there is massive value in functional movement. Now, if you are a do-it-yourself kind of person, just look up corrective exercises on YouTube. There's tons of top physical therapists and personal trainers in the world that have they've got hundreds of videos on YouTube explaining corrective exercises and the stretches. It's all completely detailed, right? This is their specialty. And so that's another reason why I don't really touch on it much, is because they've already put hours and hours into that content. So I'm not going to touch on that, but like one in particular that really comes to mind is Athlean X. This guy's got 1 million subscribers, one of the top physical therapists in the country. So if you do want exercises, just type in Athlean X core, Athlean X rotator cuff. I mean, and that's going to take you really far. But at the same time, if you don't want to do it yourself, you're local, reach out to me. I'll point you in the right direction of the top physical therapists in the area, top massage therapists, personal trainers, and even traditional chiropractors I send people to. Now, here's the other thing. If your back pain is related to your neck and you do have an underlying neck problem, then these solutions will just probably get you only so far and most likely be temporary. And how do I know that? Well, besides everything that I just explained with the science, I mean, I've worked with enough people with back pain to know that they've already tried, chiropractic and just really, they've tried everything on this list, and ultimately just looking for a different solution, like upper cervical chiropractic. And so here, like moral of the story, if you have an underlying neck problem, you need to find someone that knows what they're doing when evaluating and correcting your neck. Now, how do you know if you have an underlying neck problem? Well, you need an assessment, and the assessment is going to tell us a few things, right? If your back pain is stemming from your neck, or if it's truly the low back itself that's the problem. And that's where we'll go from there. But at the same time, like, of course, I'm biased, and I think my assessment's the most complete, tailored, one out there. What I do is I walk everyone through a series of about 15 tests, ranging from, in-depth posture analysis, weight bearing, non-weight bearing, bilateral weight differential, muscle testing, balance, coordination. And like, ultimately what I'm doing, I'm looking at one thing and one thing only. Can I trace your back problem or spinal problem back to your neck? And if I can, I'll explain what that looks like and getting that corrected. And if I can't, and then I'll point you in the right direction of someone that I know will help. And especially for my international audience out there, you guys are in different states too. Like, just because you guys aren't from Oregon doesn't mean that I can't help you. I make referrals all the time to other colleagues and health professionals across the nation. So local or not, I want the best for all of you. Now, fortunately, for the ones that are local to the Portland metro, you have super easy access to me. So if you are interested in an assessment, I'd be more than happy to test you myself. But regardless, if you're local or not, like, now is your chance to schedule your free 15-minute call with me. What I'll do, I'll ask you a couple questions, do a deep dive of what's going on, and then we'll schedule your assessment. Assessment's only $85, but hey, let's get that link posted up in the comments. Go ahead, click that link, getting that posted up in the comments. Anyway, so what I want to do is reward the first 5 who schedule. So if you're one of the first 5, I can promise that I will get you in within a week. 1 week. And so, of course, first come, first serve. After that, I can't guarantee you that I'll get you in until, next month, especially everything going on with COVID and some of my time restrictions. I've had to space everyone out because of this whole thing. I get it, it's for the better, but it is anyways. Now, my goal here is to save you time and money on figuring this out. I've literally spent the last 5 years of my life digging for the best possible solutions for back pain and other spinal problems. And upper cervical is the closest that I've personally come so far. And so even if I could just save you 1 year of time, it would be worth it to me. And personally, I've never seen a better time in my life to get involved with upper cervical chiropractic. The advancements in technology, you've got the breakthroughs with the research, now is the best time. Now, here's the thing, I could sit here and talk about all my testimonials, but, I'm not going to do that. It would take forever. If you really want to see what my patients are saying, go on Google, go on Facebook, they're there. Over the years, from California, Utah, Oregon, I've helped hundreds with spinal problems and especially back pain. But yeah, what you'll see, is the same story. I tried this, I tried physical therapy, massage, acupuncture, traditional chiropractic, tried this, and then upper cervical was the only one that worked. And, I would have never even known about that unless someone told me. But here's the other thing. I'm not telling you that, although, yeah, most of my patients do say they're pain-free in the testimonials here, but I'm not saying that once your neck's fixed, your back pain is just going to disappear forever and you'll never need any of the other solutions. What I'm saying is that correcting the neck is the absolute best place to start. Hear that? To start. And you'll notice the greatest improvement by starting there. Like personally, I still do a ton of corrective exercises, a ton of corrective stretching, get a massage here and there, but nowhere near the amount of when my neck was messed up. Now, I do want to mention, upper cervical is not for everyone. If you're looking for someone just to crack your neck or your back, then we definitely won't be a good fit. Portland is saturated with people that can do that for you. But yeah, if the only goal is to just simply get out of pain, then we probably won't be a good fit either, just because there's tons of ways to do that, temporary pain relief and both natural and unnatural. But like for me, I'm after correcting the root problem. And in my experience, it starts with looking at the head and the neck. And so if this sounds like something you want to learn more about, then I've got the perfect guide for you. Love to speak with you. Anyways, so now is the time where I will answer a few questions. I've got about 10 minutes, about 10 minutes. But before I forget, I'm a man of my word. And if you recall, at the beginning, I told you how to win a $50 gift card to your favorite local restaurant. All you had to do was take the best notes and organize them in a way and email them to me. And what I'll do is I will send all those that registered an email in the next about 10-15 minutes with the following. So it's going to have the PDF slide deck direct download link. Of course, I'm going to leave the replay up for about 24 hours. And so there'll be a link for that. And then 3, of course, link to schedule your call if you haven't done so already. And then lastly, we've got respond to the email with your notes. It's very easy. Let's say that the deadline for the notes will be tomorrow at midnight, Pacific Standard Time for you others. But then I'll probably choose a winner on Saturday. So let's see, let's come back here. All right, let's check out some of these questions. We get any questions? No questions. All righty. Awesome stuff. Perfect. Good. All righty. Drayson, thanks for tuning in. Wilson, thanks for tuning in. Vivek, awesome. Thanks, guys. And hey, thanks for hanging out tonight. You guys are awesome. If you have any other questions, down the road, I'm here for you guys. Send me an email, and I want to provide value to you and help out in any way that I can. I'm constantly, working and developing up-to-date, easy access resources for you guys. So please let me know how I can help. But yeah, I hope I see you guys soon. Take care, stay healthy, and see you next time. Take care.